And here we are together once again. Dr. Tasmin Cordie. Hi, Tasmin.
Good morning.
Everything good?
Everything's good.
What is today? May 6th?
Monday, May 6th. Yeah.
Monday, May 6th. The weeks are just ticking by faster and faster as we head inexorably towards winter. And I say that both literally and metaphorically because today we're going to talk about anti-aging.
Got it. Okay.
So this is a very fascinating topic. Just a little background. I know we spoke last week. We did a live last week. For those of you who don't know you, for those of you who don't know you, for those people who are watching who don't know you, this is Dr. Tasmin Cordie. You are a chiropractor. You are an AK practitioner, functional medicine, foundational nutrition. So you are one of these people who are addicted to educating yourself and doing better for your patients. And one of your certifications is in anti-aging medicine. Is that correct?
Yeah, it is. I since 2000, well, before 2016, because that's when I tested for that American Academy of Anti-Aging Diplomate exam, which is a really, really great organization. And I liked them so much because their teachers taught from such current material when they taught, and they were just second to none. They're so good. And they continue to be. They're really at the front of a lot of the research about brain health and neurological health, cardiovascular health, and hormone health that makes so much sense in what we're able to do for patients from a foundational nutrition place and a functional medicine place, but also from a medical prescription place, which I'm not a prescribing physician, but I have them in my practice. And so it's nice to be able to understand how those worlds can connect and work really well together.
So just to be clear, is the goal for me not to die? Is that what we're trying to accomplish when we talk about anti-aging medicine?
You know what? I think that's the confusing part about the language when we talk about anti-aging and maybe biohacking, is that, I mean, some people really talk about prolonging their life so that they live for 130 or 40 or 50 years or whatever. And if that's what they want to do, fine, go ahead. I think a better way to frame taking care of ourselves now in an anti-aging way is aging really well and until we expire. And so, like, rather than spending the last 10 or 15 or 20 years of our life getting sicker and dependent on other people to just do activities of daily living, like really super basic stuff, and we can enjoy those years and instead of just decline through them, and really plan to enjoy them.
Okay, fascinating. So, I know the conventional wisdom, or I believe the conventional wisdom, is that a person should be able to live approximately 80 to 120 years of a relatively good, healthy life. And when we look around us, we see that there are people who are practically dead at 40 and that there are 90-year-olds who are running marathons. So what is the difference between what these people are doing or what's inside of them genetically, or like what needs to happen in order to ensure that a person could live a good, healthy life for 80 to 120 years?
Well, I'm definitely not the end all to this answer, but I think generally what I understand is that the most important thing, the most important factor in us aging well is our community. And so we can talk about food, which I do all day long, and diet and fasting and water and exercise and just general movement, I think, and all of those things are important. Healthy relationships and cleaning up toxicities, whether that's your crummy water or crummy food or crummy relationships, all of those things. But I know that it's always paramount to everything to have a really strong community. And when we look at global, like the global population, and we pick out these areas of the world that are called blue zones that have like an abnormally longer lifespan and healthier, longer lifespan. That's one of the things that they see over and over again, is they have really strong community ties to their family and to their friends and to their to their religious ceremonies, and their just religious practices. That doesn't even have to be like church or synagogue related. It's just the part of the practice of their day, like regularly doing a thing to be part of their community and their like their own life, to create ritual. And that's really, really important.
But that doesn't sound scientific. That doesn't sound like what we think about with, people cutting off their heads and putting them in cryo chambers or whatever, all that wacky stuff that people are doing.
I think that was one of the surprises actually to the people who did the research in the blue zones, is that like they did all this research and they're like, well, this is like our answer paramount to everything that works better than anything else, is to have strong community bonds, community ties, community rituals. And then I think the second thing we find, based on research and like actually scientific analysis, is how much we move during the day. That's the next thing that's really important for us. And it doesn't have to necessarily be weightlifting at a gym, but just movement. And even, if we send people to a gym in the morning before work and then we sit them down all day long for 10, 12 hours in a chair, it doesn't mean that they're moving enough or they're healthy enough or like have ticked off all those boxes of being active and creating enough movement in their life. Like just going to the gym doesn't make that happen. That's why standing desks are becoming more popular. That's why standing classrooms are becoming more popular, because we know that it's so much better for our longevity in so many ways. Like as a chiropractor, one of the number one things we know that ages people is that increased thoracic kyphosis, or the spine when it starts to bend forward in the middle of the back, because all the organs get squished when that happens. So we lose height and we lose strength in the spine, and we lose expansion of the lungs, we lose expansion of the heart, and everything gets squashed. And if things are squished, they're just not going to work very well. Blood flow gets reduced, neurological function gets reduced. And then we see aging happen when we can't get oxygen to tissue because our lungs don't get oxygen into the bloodstream. We get older. I mean, that's how we live. And it's definitely how we don't age, is if we have enough oxygen going into tissue. And so that whole idea of being able to move enough and being able to move well every single day, a lot of the day, is remarkable. And it's probably not 10,000 steps a day. It's probably quite a bit more than that. And it probably includes some kind of resistance training pretty regularly. It doesn't mean, again, bench pressing. It doesn't mean sort of traditional weightlifting things, but you can do non-traditional things that if sometimes we'll just talk about just carrying heavy things around, because that's a factor of how healthy we are. And we know that. Like,
let me interrupt here though for a second. You're saying that the number one thing is community.
Mm-hmm.
The number two things is movement.
Mm-hmm.
So why are anti-aging practitioners necessary, or are they, when those are the two most profound things to help a person slow down the inevitable?
Because I don't think everyone knows that. And part of being a functional medicine practitioner is bringing everything together and like really looking at the whole lifestyle and creating space and time and energy for the things that matter most. And so, I mean,
are you saying then to your patients, you may be too isolated, you may be too idle, so you need to go find a walking group or what have you. You need to go to synagogue this weekend. You're saying these types of things.
Right. I mean, I think that, and within like this great big umbrella of functional medicine that's practiced in, 1,000 different ways, I think that's part of what we need to look at is what does their community look like? Because we know how important that is. And then what does their movement look like? And then we have to be really good at looking at chemistry and handling that from a foundational nutrition place. What are you eating?
So finally, number three, we get to the medical stuff.
The meat and potatoes. Yeah.
The physiology.
Yeah. Right. So
I
we need
mean,
to
it
be able
all
to look at
touches
blood
on
work in
food.
labs, and we need to be able to understand if there are red flags on there that are big and scary. And
For
if there are
example,
not,
what might be a red flag that would suggest that somebody's quality of life is going to suffer as they continue to age?
mhm. So if we look at how we handle sugar in the body, there are several different important markers that we can look at. And one of them is called insulin or fasting insulin. So we do this test when we're fasting. But insulin is the hormone secreted by the pancreas. And when we eat food, particularly sugar or glucose, the body responds by secreting insulin. And insulin basically opens up the doors to the cells and lets glucose in. And then they both go away. It's an easy way to think about it. So when you're fasting, you shouldn't have much insulin around because your cells should have let the glucose in, and the glucose comes down to a normal level, hopefully in like the low 80s. And then the insulin also goes away, and that's hopefully to a normal, healthy level. Hopefully around 5 is what I like to see. And then your body is in pretty well homeostasis. But as that fasting insulin number goes up, what it tells us is you're becoming more resistant to insulin.
Right.
So there's that metabolic syndrome that's happening, and then that insulin resistance that's happening. And we don't want insulin resistance. We want to be very, very sensitive to it.
Right. So if I may, just so people know before we geek out too much.
Yep.
So we're talking about the insulin system and how it works and how it contributes to aging and how it contributes to ill health. So,
Mm-hmm.
for example, when a person's insulin system is not working well, when their numbers, their blood sugar, their A1C is too high for a prolonged period,
Mm-hmm.
what then happens to the body? How does that contribute to the body breaking down faster?
So if you generally think that when there's too much glucose in the bloodstream and when there's too much insulin in the bloodstream, generally speaking, it breaks things. When there's too much glucose in the bloodstream, glucose gets stuck onto our tissues and our cells, and it creates aging. So it makes things older, it makes things wrinklier, both inside the body and outside the body, like on the skin. So when we have glycated tissue or
So that
glucose
means
stuck
tissue
onto
with,
tissue,
right,
mhm,
glucose stuck onto the
when
tissue.
we have glucose stuck on tissue, it creates an aging effect. And when things get older, they don't work as well. When they're aged or glycated or there's too much glucose around, they just don't work very well. And generally speaking, again, glucose and insulin are inflammatory and they break things. So we want them lower because we don't want inflammation in the system, number one. And number two, we don't want things broken just because we have too high of glucose or insulin levels.
Right. So, for example, when blood sugar is too high, again, for an extended period of time,
Mm-hmm.
the body will start attacking itself, essentially. I mean, the
Mm-hmm.
nerves start to degenerate and decay.
Mm-hmm.
And this can lead to really horrible outcomes. I mean, diabetes is absolutely
Mm-hmm.
nasty.
Mm-hmm.
I
Right.
was having this conversation this last week with one of my clients. He was saying that a relative of his just is diabetic, and yet he feels he wants to quote unquote do it by himself. He wants to lose weight, get healthier by himself. Of course,
Mm-hmm.
he never has in all these years.
Right.
So he might be living a lie right there. But what he also doesn't know is the extent or the degree to which this will eat him alive.
Mm-hmm. And so to help handle a situation like this, that there's a chemistry marker off, we need to look at everything because probably one of the most important lifestyle factors or features of high insulin or out of control blood sugar, whichever marker number we're looking at, is poor sleep. And so we have to get people sleeping well and falling asleep and staying asleep and getting enough deep sleep and enough REM sleep so that they can repair their blood sugar handling system, which is why, again, it's a bigger approach than just taking a supplement that helps handle blood sugar, both at the pancreas or the cellular levels.
Right.
It's a bigger answer than just eating less carbohydrates at breakfast time. And all of those things are important. And we need to curate really individualized and special supplement programs per body to do those things. But we also have to look at like the reasons why they're not getting better when everything looks really good, like on paper, when we look at either dietary or ritual kind of things that they're doing.
Tasmin, I have to tell you, so what I'm experiencing right now is the same thing that I think a lot of people are experiencing when just looking at society in general. The
Mm-hmm.
last few years, the messages we've gotten was that things are too big. Things are too overwhelming. There are too many forces against us. And this has led to a kind of a deterministic understanding, like, these things are going to happen. It's inevitable, and that leads to, like, nihilism. I mean, and just hearing you talk, the three factors, the first three factors you're saying are lack of community. We know that communities are breaking down and changing in various ways.
Mm-hmm.
You're also saying movement, and we know that our lifestyles are much more idle. Most of us are not, farming our own food. We're not hunting. So that seems inevitable. I mean, this is how we live our lives right now.
Mm-hmm.
And then you're talking about the effects of sugar and carbohydrates on our body. And, that's ubiquitous.
Mm-hmm.
So, I mean, it just seems like an impossible task to fix all these things.
I
How do
think
you help people with that?
Yeah, I think it's impossible to think it can be perfect in like some certain amount of time. Like there's not a finish line with this. And that's, I think, reframing like how we're going to work on this is vital to anyone's success, because if it's just completely like nihilistic, like if it's never going to happen, there's never going to be success, like to perfection, then why would we even begin trying? But that's not the goal here. The goal is to be better from this week to next week, or this visit to next visit, not perfect. And so you can start etching away at the behavior patterns and the food patterns and the all the other things that are part of health: sleeping well and going to bed earlier, prayer, meditation, breathing exercises, exercising, choosing exercises that are not so stressful. Like we can start working on all of those things. So between today and next Monday, things are improved. And that's really all we're looking for, is improvement. And the degree to which you want to improve then is really determined by how many things you want to do this week and how many things are sustainably like squeezed into your very busy life, and then can stay in to continue making you better. We don't have to do everything this week, and we don't have to do it perfectly this week. It just has to be better than it was last week.
Well, there's the carrot and there's the stick, right? The stick being that, people can die young, and before they do, they could be in a horrible condition, pain and lack of mobility and reliance on others, and all of these things that when you get to a certain age, you start to think about and dread and want to avoid,
For sure.
right?
Yeah.
But let's talk about the carrot a little bit. You've studied anti-aging medicine. You have a lot of experience. You've had thousands upon thousands of interactions with patients over the years. And you've looked at blue zones, places like Loma Linda, California, and Icaria, Greece. And so what is possible for people? What is the best case scenario?
I think the best case scenario is to look at what you're doing and see how you can make it better.
No,
And
not process-wise.
is that what you mean?
No, I don't mean
Do you
process-wise.
mean
I
outcome?
mean,
Like how old can we get?
how old can we get? I mean, how functional can we be? Like, what is the ideal situation?
I think that's individual. Like we all
Without a
come in.
doubt.
I mean, obviously, I'm sort of saying almost redundant things, but I think that how we come into this and how we were raised and what our genetics look like and what our environment looks like all of these things determine probably our average ability to live to a certain age. But I think how we live to that age has far more to do with our behavior than all of those things, than what we came in with and what our physical environment looks like. And I think for the most part, we have a lot of control over our environment, including what we eat, including how we do food, including our rituals, our movement, like all of those things. I think we have an enormous amount of control over that for the most part. And then the other things I think have a lesser and lesser pull on us. And depending on where you live in the country, some areas are more stressful than others. Like we're
You're
in New
kidding me.
Jersey. It's so intense here. I practiced in several different areas of the country, and it's so intense here.
Is this the most intense place you've been?
Oh, clearly. Like, and I
Okay.
lived in Fort Lauderdale for a couple of years, and it's a lot there because there's so many people from New Jersey down there. But
You're going to blame the problems of the whole country on New Jersey?
it's a
Kind of
different
unfair.
flavor of like aggressiveness to like do things more and better and faster and a lot. Like everyone's plate is full here. It's amazing to me. Everyone's plate is full.
I have seen that myself.
Yeah.
Yes. But
So,
I guess what I'm trying to get to, what I'm trying
Mhm.
to ask is, and again, you don't have to like be careful about your words, right? It's not a promise that we're making to people,
Yeah.
but a person needs some hope.
Mhm.
A person needs some examples. So
Mhm.
if a person does do all the things right that you're saying, if they're mindful about their community and their relationships, if they're mindful about movement, if they're getting rest, if they're doing the right things to make sure that their hormonal system is working correctly,
Mhm.
um, can they expect to be dancing at their 105th birthday party? Not expect. I don't want to say expect,
No,
but is it possible? What is the carrot? What is the best case scenario?
I think the carrot is that if they do all of those things like as well as they can, like to the degree that it fits into their life and doesn't doesn't have a reverse effect of making them isolated and crazy because they're being they're being too intense about it. And it has almost an opposite effect. I think
Right.
doing those things, we know that it's going to help them more than not doing those things. And so rather than like making a line in the sand and saying like this is the one that you can cross if you eat well or whatever, I think you're going to do better than if you didn't do all of those things, whether it's sleep or create community or exercise or whatever. It's just better than without it. And I don't think anybody can say you're going to live to 80 no matter what. I've got lots of old relatives who've lived for a long time in my family. I don't know that that's going to be me. Like I'm going to do the things that I know I want to do that take care of me better so that's more likely than less likely. It is less likely if I have French fries and Coke for lunch today that I'm going to make it that long. It's more likely, that I'll make it if I
Well, if immediately after that you run to church, then your chances are better.
better than if I go back to work for another 10 hours. Yeah.
Although obviously that is the more immediate concern, right? Your clients need you. You have
Yeah.
to sacrifice yourself to some degree to make sure that they have good outcomes.
Right. But I think the sacrifice is, I think when we have onus over the responsibility of making that sacrifice and making the decision about it, it's much different than if we don't have
Yeah.
the ability to decide for ourselves.
Tasmin, what keeps you up at night when you think about your patients? What is your main concern for people?
No, it's usually something along the lines of like, what do I need to do to get them to a place that keeps them deciding good things for themselves, and so that they can eventually sort of look behind them and like recall the work that they put in, but also stay there and not revert back to the bad lifestyle decisions they used to make. And they can physiologically and like in their body feel the difference, and that's enough motivation to keep them going on this in this same direction, rather than like having huge symptoms that feel terrible. I'm waking up with heart palpitations, and my knee hurts all the time, and like lots of really big ugly stuff, right? But rather than those kinds of things, like the smaller stuff, like just a genuine sense of happiness and well-being and nourishment and peace and connection, like those things, like if I could figure out how to make those things motivating factors, and then like have a way to monitor those metrics, like that would be great. Like to get people there and keep them there is really,
Yeah, I mean, it's so hard to give that to people. I
yeah.
mean, there's so
Hmm.
much has to do with, people's choice and their, belief systems, etc.
Hmm.
In my office, Tasman, when a person finishes a program, we give them a survey to fill out. And my quality control question to them is, um, are you happier, healthier, and more hopeful now
Hmm.
than you were before?
Hmm.
So this is where things can get a little weird sometimes
Right.
because, they might have lost 30 pounds in a short time, right?
Yeah.
They might have more energy and they're sleeping better and fitting
Yeah.
into their clothes. But
Hmm.
those things to some degree is a choice. If a
Hmm.
person has a lifetime of looking at the negative of what could go wrong
Hmm.
exclusively,
Hmm.
they may not be more hopeful. They may not be happier than they were before. And this is where things can get kind of funky. I mean, is there anything that you do process wise where you're able to help people, I don't know, with their perspective a bit?
I think that comes from just all of the work and then the ability to reflect on where they started and where they are.
Yeah.
No, I mean, we do exams regularly and questionnaire exams, like, how are you? How do you feel about these dozen different questions that we have? And so I think that gives us a little bit of a line in the sand, like, are we missing something? Do we need to work on something? Right. Um, I used to have a similar question on forms I used years ago, actually, and I don't have it anymore. But the last question on my patient intake form used to be, what can we do to help you be happier? And when we put it on there, I thought, we'll just see what happens with this question, because like
Yeah,
everybody,
I'd be a little afraid. You don't know what kind of answers you're going to get.
I I didn't know what to think, and I thought, let's just add this and see what happens. And like all the other stuff on there, patients filled out, male and female and address, blah blah blah, and like I have digestive problems, I have hormone problems, whatever it is, gave me all kinds of details. And they had 90 pages of labs that they brought in for their first visit, and we looked at everything. But that question was remarkable. I mean, some people would say, we could win the lottery today, like things like that. But more often than not, like there were really obvious answers that no one ever asked them, but when we did, they had an answer, and it was like a
Give me
one
some
line.
examples. Yeah.
You know, the last time I asked this was actually just in a consult not terribly long ago, and his answer was like, I want to be more peaceful, and I want to be more hopeful, and I want to be better connected to my higher spirit. And it was just like this lovely answer that was so heartfelt. And without asking, like, what would make you happier, or how can we help you be happier, like it's obvious that he's thought this out, but
Mm.
like written it nowhere. And I always ask, like, do you have that somewhere? Do you think about that a lot? And patients always say, well, no, but you asked me the question, so like that's my answer. Or instead of saying, how can we make you happy, or other question or other answers to that were like, help me, like, I want to be able to connect better to my children. And like what I do has nothing to do with that, but it has everything to do with that, because healthier bodies mean healthier minds and healthier relationships. And the stronger you are physiologically, and that's my focus in my practice, is the chemistry piece of this for sure. But the stronger and healthier you are physiologically, the better you can show up to the rest of your life.
Hmm.
And
But do
so,
you have resources? Like when you asked that question and you were getting these answers, do you have resources whereby you guide people to get some assistance with that? I have some. You
I
know,
have some. I have
yeah.
some, but usually they've explored those resources and they're here because this is the thing they're missing.
Hmm.
Like they're missing the piece of their physiological chemical balance in their system that we need to figure out and refine for them so that these other parts of their life can get better and basically like the boat can float higher, like everything can be raised up and have the opportunity to be more productive
Yeah,
in
I
whatever way
think
they're
I
looking at.
think people might poo-poo the degree to which health, physiology, energy will dictate their general emotional tone.
Mhm.
It's
Mhm.
very difficult if you're sick to also be deliriously happy. Some people
Right.
apparently can pull it off. In fact,
I think
I have a friend who
yeah,
wrote a book about that
yeah.
recently. Her experience with cancer, and
Mhm.
but it's really happy, especially if you're exhausted. You know,
Mhm.
we talked earlier. We mentioned obviously aging. We mentioned which has to do with time.
Mhm.
Father Time is undefeated.
Oh,
Uh,
right. Like he's gonna win. Right.
He's gonna win, right? And but
For sure.
the other thing that humans can't seem to beat is lack of energy and exhaustion.
Mhm.
This is true as true in interactions in daily life as
Mhm.
it is in MMA. When a guy's lost it, when he's got nothing left, I mean, he's done.
Mhm.
So I think this is part of the contribution that you make and that hopefully I make. And
Mhm.
we need to, we all need to get better at this.
For sure. Yeah. Yeah. I think like having the self-awareness to understand when we have nothing left to give and to be able to like recede from like work and play and whatever it is that's draining us to refuel. Like I think we need to know how to do that on our own and we need to have good boundaries about who's responsible for doing that for us.
Right,
Um,
when it's not a physiological thing, which
mhm.
you are taking, largely taking responsibility for.
Yeah. Yeah.
Not entirely, obviously, but largely.
Yeah, not entirely, but the guidance piece of it is inevitably necessary once someone's in front of me in my office and in your office asking for help. Like
Right.
because if Dr. Google had all the answers, they would already be where they wanted to be because, you know,
Wouldn't
there's
that be nice?
it would, but this is also circling back to the first point about anti-aging is that community and connection and human relationships is so important and it's probably more important than anything. And so to have someone to be able to trust and to allow them to guide you through a thing, whether it's chiropractic care or physical therapy or some kind of psychological support and a counseling therapy or nutritional foundational medicine kind of therapy, like being able to have that connection with someone and walk that path together and work on that thing together is maybe the most important part of the relationship rather than you can eat this for breakfast and you can't have this for breakfast, right?
That was very well put. I mean, that would be if I repurpose this content, that would be the
Mhm.
blurb. Unfortunately, I don't have those skills, so I hope people will listen that long so they can hear that. But it's also a great place to end off because
Mhm.
I know that you have someone waiting for you right now.
I do, but this is perfect timing. So thank
Yes.
you. Have a good week.
Thank
Thanks,
you. You
everyone.
as well. I will see
Mhm.
you tomorrow.
You got it.
All right. Take
Okay.
care.
Bye.
So, again, a great conversation with Dr. Cordie. She's always very thoughtful. And here's one of the things that occurs to me right now, and I think the note upon which we'll end off. I mean, a lot of our conversation opened up other topics that we need to explore, or I need to explore. Tasmin won't be with us every week, but the thing I was thinking about is this. In the future, there will likely be machines that we plug into. They will be able to stimulate areas of our brain. They will be able to manipulate things in a certain way. Maybe they'll make us happier. or maybe they'll make us feel more connected by artificially tickling these areas in our brain. That future is a bit scary also, because who knows what's going to come of that, right? Just like any technology, there's a good aspect like AI, and then there's just a frightening aspect because AI will eventually kill us all. I think we're aware of that at this point. But until this future comes whereby our physiology can be completely turned over to techies, we still have to take responsibility. Whether that's for, as Tasmin said, creating community, whether that's about not eating the cake all the time, whether it's getting up and moving. And we can use technology to remind us of these things. These watches that we wear to track our steps. I refuse to wear them because I think it's just one of those steps closer to this, technocratic thing where we're ruled by our tech. But we can use these things to remind us. They won't do it for us. I think this is a really important point. The onus is still on us right now. That's the bad news. It's also the good news. As Dr. Cordie said, we still have more control than we think. If only we did the right things and we did them on a consistent basis, right? So anyway, that is where I'm going to end off before it gets into a soapbox lecture-y kind of thing. I never want to go there. But I want everyone to have a great week, and we'll see you next week. Take care.